in the public health team at Lincolnshire County Council. I've been working with Liz and the PH team on a rapid research project with our employee health and wellbeing strategy that we'll come on to talk a little bit more about in due course.
Great, thanks Dave. My name is Liz Such and I work with fabulous colleagues including Andy, Joe Langley who's on the call, Fiona Marshall who's not able to attend, and Naima Ahmed who works with us from the charity Africa. We all work together as a team on the NoPH project, and I'll introduce you a bit to the programme overall when I start sharing my slides. So I'll do that now. We're going to talk for about 25 to 30 minutes, myself and Dave. Feel free to put questions in the chat. We'll have quite a lot of time for questions at the end. We aim to finish after about 45 to 50 minutes so that you still can reclaim 10 minutes of your lunch hour and get to your next meeting. So that's the plan. Let me share my slides. Okay. Hopefully you can see all of that. So we've introduced ourselves, and this is the topic we're going to cover today. So we're mobilising NIHR, so National Institute for Health and Care Research, with local government, and we're going to use the example of Lincolnshire County Council's Employee Health and Wellbeing Framework.
Liz, I can't see the slides. I'm not sure if others can or not.
Okay, thanks for telling me, Dave. Let me try that one again. Okay, let's try that one again.
Yeah, I can see them now.
Okay, thanks for jumping in, Dave. That's helpful. Okay, so in the next 30 minutes, we'll introduce you to the programme overall, if it's new to everyone, and then Dave will take over and outline the challenge that he was faced with in his council of revising the health and wellbeing strategy. Then I'll work forward and talk about how NoPH and the council work together in this novel knowledge mobilisation project, and then finish on what we learned. And there are many, many learning points from this initial project. But first, what is NoPH? I'm just going to switch over to Genially. So NoPH, we've got lots of partners on the right-hand side of the screen there. I'm at the University of Nottingham, Joe's at Hallam, and Andy's at Sheffield. I've mentioned Africa, who's our community and public engagement partner. So we have a community engagement group. And also City of Doncaster Council is one of our partners. We also connect with a range of creative agencies to support our work. What do we do? Well, we, as a first public health knowledge mobilisation team, we fundamentally try and get evidence, NIHR evidence, but also other evidence, much closer to decision making and to the general policies and practices of local government in particular. We've got three main parts to what we do. We have a creative focus. So I've already mentioned we work with creative agencies, but we try and do a lot of the creative stuff ourselves. We focus as much as we can on health inequalities. So we see problems that we're presented with through a health inequalities lens. And then we also try to do our work co-productively. So we work in partnership, we work with local authorities and other partners to mobilise evidence. So we have a co-approach, a creative approach, and we try and see things through a health inequalities lens. The two main arms of the project are a rapid response arm and a deep co-production arm. So in the field that we're going to talk about next, we were engaging in a rapid response piece of work. So we took a 3 to 6 month period. We actually worked for 6 months together to mobilise evidence that relates to a specific problem. But the other part of the experiment of what is NoPH is to take on much deeper co-production projects where we work with local partners over a much more extended period of time. So Joe is currently working with Leicestershire County Council and Knowsley Council to work on very broad topic areas such as housing, planning, and health impact assessments, air quality as well, to develop, co-develop the solutions to their problems in a much deeper, more continuous way. And that does engage a lot more with the creative agencies that we are partners with. So we've got these two arms. We'll cover deep co-production in more depth when we have more of a programme to tell you about that's been concluded. But this one today will focus more on the rapid response work. We've got functions across 4 levels really, focusing on topics. So our public and community engagement group help us choose topics alongside our local authority reference group, which is a group of local authority partners mostly working in public health, which anyone in local government is welcome to join. They help us prioritise our topics and advise us on the sorts of approaches that we're using, and it's proved absolutely enormously helpful, and you can engage in that at whatever level you work at in local government. We also have priorities from NIHR, and we also need to have an evidence base to work from so that we have something to mobilise with local partners. We're expected to engage in active processes and as you know, co-productive processes of knowledge mobilisation with local government, but we also work with some national government partners and some of its agencies, and some of the stuff that we did in this project on health and wellbeing in the workplace partnered with the Health and Safety Executive. We're expected to do wider knowledge sharing, so this is what we're doing now. We've got other programmes too, and we have a fantastic programme of knowledge management and science communication led by Andy. In terms of outputs, we've got a huge array and a diverse array of knowledge products already produced, and we can share those through our Figshare archive, and as you know, we have like a YouTube channel and so on. We've got a very changing and active website. We're also expected to produce towards the end of the programme, which is a 3-year programme, a guide for knowledge mobilisation, or guide to knowledge mobilisation for local government. And this really fits with the other ambitions of local authorities to be more evidence-facing. We're also doing some work on creative approaches, sort of find out what works in what ways and with whom. And we started that off with a scoping review. In terms of our outcomes, we're expected to have impact, so make real change in local government through the substantive work that we do, but also build capacity for local government to become more evidence-facing and to build capacity among researchers for knowledge mobilisation. In that way, we would advance the fields too, so provide insight into how these things work in practice, and we do that through the evaluation, the continuous evaluation that we're doing. So that's us, and this is the first rapid project. So through a process of working with NIHR, working with our public and community engagement group and our local authority reference group, we narrowed the first rapid project down to a project on workplace and in general employee health and wellbeing. We did this with the national government department's areas of research interest leads, which is quite an interesting function, and you might be able to find it online or be already aware, but every government department now has a strategy or areas of research interest that they want to engage with researchers on, so that's worth checking out. They were interested in these core cross-departmental interests in workplace health and wellbeing that included Department of Education, Department of Health and Social Care, and the Health and Safety Executive. And we also discovered through our local authority reference group was an area of live interest and activity among local authorities too, which is where we began to partner with Lincolnshire County Council, and that's what we're going to talk about just now. So if I go back to the PowerPoint slides and pass over to Dave, let's start from here, and I can do the classic next slide please, Dave, for you.
Thanks, Liz. Yeah, so in terms of where this project came from our point of view, so it was really timely actually, because one of my programs of work is leading on a program within the local authority around supporting the local authority to become more research active. So the more that we can embed research and evidence-based practice into everything that we do in the local authority is great from that point of view. And also we wanted to make sure that our employee health and wellbeing strategy is as evidence-based as possible. We did have an existing employee health and wellbeing strategy which was published in 2018. One of my roles in the public health team is to co-lead that with our colleagues in our HR team. And so our existing offer since 2018, it's clearly iterated and changed over time to reflect the kind of changing pattern of needs that we've all been through over that period of time. But it felt last year that it was an appropriate point in time for us to take stock and to review that strategy a bit more fundamentally, really. So we've got a range of things that are already in existence that support our staff around their well-being. So from the mental health point of view, we're a mindful employer, and we have a range of things that support staff there, from over 65 mental health first aiders in the local authority. We have personal support passports where people can use those as a way of reflecting and having conversations with their managers about certain aspects of their lives that may impact on their working life, and how there may be kind of some reasonable adjustments that might support them with that. And actually personal support passports or health and wellbeing passports, there's a whole range of those types of things used in a whole variety of different workplaces. And one of our other research projects at the moment is to look at evaluating the impact of those personal support passports for the individuals that use them, and also the impact on the organisation as well, because there's a bit of a kind of paucity of evidence about their use really in the literature. And we also require a mandatory requirement for all staff to complete the Zero Suicide Alliance e-learning as well, in terms of our suicide prevention agenda, which I also lead on from a public health point of view in the county. From a physical health point of view, within the public health team, we commissioned an integrated lifestyle service in the county to support people across Lincolnshire with stopping smoking, tier 2 weight management support, physical activity, alcohol brief intervention, and so within that contract, we wrote into that the provider of that integrated lifestyle service should support our staff as well in the local authority, because we felt that was a really important aspect of that contract. So we've worked quite a lot with One New Lincolnshire around that kind of physical health support for our staff as well. And there's a range of things they do with us on that. And then the other aspects around financial health and wellbeing. So we work very closely with our credit union. We allow staff a salary sacrifice so they can get they can set up a savings account with our credit union, which obviously supports our local credit union, supports the people that they support, which are often the most kind of vulnerable and, from a health inequalities point of view, disadvantaged people in our communities. But equally at the same time, it allows our staff to get a really good kind of way of saving for themselves as well. So from a financial point of view, there's a range of things we offer as well, and some of those are listed there too. Liz, would you like to move on? Thank you. So just a couple, there's a few sort of, we obviously try and track the impact of our employee health and wellbeing offer as much as possible. There's a few kind of successes that we've captured, and examples of the sorts of successes of the employee health and wellbeing strategy so far. This is from April to November 2023, as it says. I won't go through all of the stars on this slide, but in terms of a couple of them, the 267 new referrals to employee support and counselling service. We have an in-house employee support and counselling service in the county council. That's worked really well for our employee health and wellbeing offer. They're part of our project team, and it allows us to be really flexible in terms of what they are able to offer us. So they've developed their offer over time in line with our employee health and wellbeing strategy. So they now offer things like trauma training and grief and loss sessions. They offer wellbeing check-ins for staff who maybe don't need a formal course of counselling, but nonetheless just need to kind of check in with someone, have a conversation with someone. From a stress point of view, it's fairly consistent that about 70% of the referrals into our employee support and counselling service come from stress that's related to situations outside of the workplace. So they support anyone regardless of the background to the issues that they're facing, which I think is a really important point to make on that one. And the 360 LCC staff signed up for the Miles Better programme. So that's one of our One New Lincolnshire physical activity offers. We do an annual physical activity challenge where people can enter as teams or individuals to get more active and track how active they are over a period of 12 weeks, and we do kind of league tables, and we have a celebration event at the end of that as well to give out awards, etc., for people who've really improved their physical activity. And it's not just about those that can run or cycle for hundreds of miles, but it recognises movement with intent. So people that are able to kind of demonstrate that they've undertaken some activity to their own abilities, and be recognised for that as well. So that's a really important part of our offer as well. Liz, would you like to move on? Thanks. So in terms of reviewing our strategy and our offer, we had 5 key lines of inquiry. They're on this slide. So obviously we wanted to understand what people felt the strengths and weaknesses were of our current approach and our current strategy. We wanted to talk to people about what did they think the priorities should be, what should we focus on when we do refresh our strategy. We also had a discussion with staff and focus groups around the way in which we might monitor the impact and the progress and the outcomes of our strategy. And also, crucially, how can employees support and promote the strategy within their own areas of business? So some of the feedback that we got, and you'll see this as we go through the presentation, is we moved away from calling it a strategy towards calling it a framework. And that came from staff engagement and the fact that they felt that a strategy made it feel like it was sort of slightly detached from them. And actually, we wanted employees to feel like they owned this as much as, you know, the organisation did. And so we talked through our key lines of inquiry with staff about how did they feel they could promote it, and how did they promote it? What were some good examples of them doing that in their own areas of work? And then obviously we wanted to work with No PH around how can we make sure we are evidence informed in the way we develop and deliver our health and wellbeing offer to all staff. Thanks, Liz. So in terms of the review, we obviously work very closely with Liz and her team around the rapid review, which Liz will talk a little bit more about coming up next. But we also did some other kind of engagement activities. So we held workshops with our staff reference groups, with our organisational development steering group, with our mental health first aiders. We had a managers health and wellbeing focus group where we talked to managers specifically about the challenges they face. And some of the feedback that we got from them was they face challenges themselves because they're employees as well, but equally in terms of how they manage and lead teams and the way that they can do that in a really supportive way of people's health and wellbeing. We did some work to look at other local authorities in terms of what they do and what other local authority strategies have included within them, and did some comparisons with our strategy in terms of seeing where there were synergies and where there were differences, and presented some of that to those focus groups to have a discussion about what things they felt, you know, were useful from other areas. And we have public health librarians in our public health team here at the County Council, so they also did a literature review of some of the latest evidence as part of the review of the strategy. So they were looking at the academic research in this space, but equally they were looking at the kind of grey literature in terms of the latest sort of policy guidance from national organisations like NICE and the NHS and the Child Institute for Professional Development, Personnel and Development. So a whole kind of range of evidence that we also use to inform that work. We then we made sure we built feedback loops into all of this. So when we had the workshops, we took that away, we wrote it up, we fed that back in terms of what we thought that was starting to tell us. We fed that back through to those groups so they could sort of on a continuous process challenge and confirm us and just sort of sense check what our findings were telling us and whether they felt that fitted with what their views were. And then obviously lastly, and I'll hand over to Liz to talk about the collaboration with her team and the work that she did to support us in terms of just kind of shaping some of our thinking around that evidence base and how we could use that in a really practical way in terms of our new framework. So Liz, I'll hand back to you.
Great, cheers Dave. And I suppose one thing that's easy to draw from what you've just covered is the fact that an awful lot of work had already been done, and there was, you know, a considerable triangulation of different types of approaches that you used in order to move this strategy and develop this new framework. So we were in a very fortunate place as a knowledge mobilisation team to be able to support with the evidence because you'd already done so much already, and you were very generous in the sharing of that with us. So for those of the audience who are interested in the process of working in knowledge mobilisation with the councils. This is how we approached it as a team, and this is what we kind of agreed as a team, meaning everybody involved, not just from No PH but from Lincolnshire too. We developed this kind of process, and it looks very linear, goes from one end to another, and it was a timeline, but as most people who know work in this field, it's very iterative, so there's lots of back and forth, lots of communication and finding out and sense checking things as we go along. So it's a good guide, but it's not as linear as it looks in reality. I'm just going to move back to the interactive element of this, because it kind of helps to see what's behind these icons. So when we started off, we were obviously doing the very early phase, establishing foundations for co-working. So we agreed on what we were going to be doing. We started to narrow down the area of interest. We took on board some of the material that has already been shared with you now. So we established connections and some common ground, and Dave from his side identified key staff, and I had the lead on this particular project, which was good for point of contact. I'd outlined our shared concerns. The council wanted to refresh the strategy, which had not been updated since 2019, which obviously was a pandemic in between, so there's probably some updating needed anyway. And we were already working with the Health and Safety Executive on outlining the workplace health evidence produced by NIHR. So between us, this was really quite clearly an opportunity. Not a lot of the literature about research evidence and about getting evidence into practice or policy talks about windows of opportunity. It's an age-old theory, and it really is something that we've taken quite seriously in the programme team, to find where those windows are and invest in that time to see where the window is, so that you can meaningfully make a difference. We did put together a project specification, which, when we share this link, you can look at the project spec, and you can also look at the old health and wellbeing strategy. Then we began to share. So we exchanged our different knowledges and some of the evidence. And we were trying to find that really nice sweet spot of balancing the knowledge from local intelligence and lived experience with the knowledge from the research evidence base. And so the way we were sensitising ourselves as a programme team was looking at things like the council's values, which had been refreshed, the old strategy, and the evidence that David got from the surveys and from the focus groups. So we were presenting bits of evidence to the team, getting a reaction and response, whilst also looking at the evidence that they had for us to build on. This was all done online, and then the mapping phase was really the kind of like more our responsibility as a programme team. And when we were presenting the evidence, we did produce like some quite classic summaries of evidence in sort of tabular or matrix format, where it offers the user the opportunity to go into the evidence, look at the summary, go into the evidence and find the connections to full papers or full reports, which can be huge and overwhelming. So we decided at this point to interrogate the evidence base as what was available to us by producing this, what we called a knowledge board, which is an interactive tablet of evidence bites. And these are the topics that we narrowed down initially, and we wanted it to be narrowed down even further so that we could engage in the more useful sense-making face-to-face workshop, which would take place at the council. And through the process of exploration of this evidence knowledge board, which again will provide links to, provide some indication of what is available in terms of the evidence base from NIHR, the council decided to explore in a deeper way issues around culture, line management and workload stress. And so we didn't focus so much on questions of EDI, working from home and the office environment. That's for various reasons, but it was a case of trying to support decision making to prioritise from our point of view so that we could get the most out of the time we had together, because it was quite limited. So that was the mapping phase. The sense-making phase was in the setup of this face-to-face workshop, and we just engaged face-to-face on one occasion, but it was a half-day workshop. and it brought together human resources from Lincolnshire County Council as well as the public health team. And what we were trying to do was bring evidence to life by cross-referencing the evidence with the interests of the local authority. And we were trying to encourage this blending of knowledge so that we had the balance of evidence and local knowledge. We did this through 4 activities, and again, this is all discoverable through our outputs. We did lightning evidence talks, which was about sensitising people to the evidence available that was most relevant. We did an exercise called turning council questions to human questions, which is from design thinking. It's from business questions to human questions, by looking at personas, by interrogating personas, by building pictures, rich pictures of what potential employees at the council how they might respond to particular support from council health and wellbeing provisions, and then again engaged in a process of prioritisation with dot voting. So if you were to act in a certain area, what would be the priorities? And we had lots and lots of post-it notes and various kind of notes and memos around the room where people were able to vote on their priorities. And this was a full kind of 4-hour exercise, and it was congenial and really, really nicely put together by Dave and his colleagues at Lincolnshire. So we can share all of this material with you. There is the kind of the scary bit from a knowledge mobilisation point of view is, I suppose from our point of view, speaking from the programme team point of view, is how you bring all of this together. So we did the classic write a report. There's a workshop report everybody wanted to see an output from the event, and of course that's supported the health and wellbeing framework, and it was published actually this year. Dave, I think you probably correct me in how it was published, and we were included in some of the material that was part of the framework, so that was great. But what was quite interesting in terms of monitoring how material was used, I felt like the output in terms of the final report might have been actually less useful than something like this, which provided everything together from starting through to blending the knowledge to be useful for the local authority. So that was quite an interesting insight. But you can see just a picture from the day. We got some Lego serious play in the background here, and plenty of post-its where people were dot voting on the right hand side. Okay, so that's the approach that we developed, and we've been using that with our partners in the next project, which was with Kent County Council on a completely different topic, and we're using it again now with Hertfordshire County Council on a different topic again. I think from my point of view, what's been interesting and novel about this programme is that we're mobilising the evidence of other studies. So this isn't research that we've generated ourselves. This is evidence from other studies. So across the NIHR portfolio, which is really reasonably new experience for me as a researcher. And perhaps talk about that a bit later. But I will now hand over. Sorry, I missed that one. Again, I'll hand over again to Dave so he can talk more about how the strategy ended up, how the framework ended up, and we'll talk about some of our learning points.
Thanks, Liz. Yeah, so the resultant framework, it has just been published at the start of this year. We've built it around 3 core pillars of focusing around physical health, mental health and financial health. And there's some examples here. This isn't all of the bullet points from the... Oh, sorry, Liz, it's come off the slides there. Thank you. Thanks. But these are just some examples of what we've included in terms of the commitments in the new framework. So from a physical health point of view, for example, very much about kind of supporting colleagues who have pre-existing health conditions or emerging health conditions to both remain in work and also access work, creating an environment where colleagues feel empowered and are educated about their physical well-being. So very much sort of along the kind of health literacy type lines. From a mental health point of view, again, some examples there around supporting cultures for an open discussion around mental health and wellbeing. We're doing a specific piece of work this year around neurodiversity in the workplace and how we can support neurodiverse colleagues, and supporting people with their emotional and mental health more broadly in terms of building their building healthy, collaborative, nurturing and supportive relationships in the workplace that support people's good mental health and wellbeing. And then from a financial point of view, ensuring we have a fair and equitable employee rewards and benefits offer, supporting colleagues to become more aware of their finances, so continuing the work around financial planning sessions, workshops and pre-retirement workshops and those sorts of things to get people thinking about planning around their financial situation and their financial health as well in future. And we do things like specific financial health MOT. We've had specific financial health MOTs as an offer to staff as well, where we can kind of talk to them about their finances and planning with our HR and finance colleagues to support them in terms of planning some of that as well. Thanks, Liz. It also aligns, as Liz referred to in her slides, it aligns really well with our new corporate values, which were reviewed last year, and we've aligned the framework to those around being collaborative, adaptable, responsible, eco-conscious and supportive. And we also, what came out of the engagement we did with our through our workshops and with our staff and managers was a kind of series of statements about what we're committing to, both as an organisation, as employees, and as in employees with management responsibility. And that phrase, employee with management responsibility, came out loud and clear from when we held the managers workshop, where they were kind of saying to us, talk to us as managers and how we can support our staff with their health and wellbeing, but don't lose sight of the fact that we're also employees of the organisation ourselves and we have our own health and wellbeing needs. So rather than talk about managers' responsibility, that's where that phrase employees with management responsibility came from, very much from the staff who have management responsibility. And again, there's lots of commitments within the framework. These are just a kind of example for each of them. So as an organisation, supporting and maintaining a safe and healthy working environment. So we continue to, for example, review our employment manual of all of our kind of employment policies in the council against the latest, most up-to-date NICE guidance on workplace health, to make sure that our employee policies are supportive of staff's health and wellbeing as much as they possibly can be, based on that latest evidence as well. In terms of employees with management responsibility as well, they have commitments within there in terms of those employees particularly developing their own knowledge, skills and competence about having things like sensitive conversations with employees, managing difficult conversations with employees in order for them to get the most appropriate sources of support. And then as employees, taking some personal responsibility over their health and wellbeing, but equally supporting colleagues within their teams to signpost to appropriate health and wellbeing offers within our framework as well. And Liz, I'll hand back to you. You're on mute, Liz. You're still on mute at the moment, Liz.
Liz, you're on mute.
I'm really sorry. I seem to be really struggling with the technology today. It's all user error. Okay, what did we learn? So I've already suggested a few things that we've learned as a knowledge mobilisation team. Because remember, this was the first rapid project that we did. So mobilising in an area where there's an imminent decision or pressing issue, that's really been important for us as a kind of learning point. This was a window of opportunity. There'd been a lot of work done and we were supporting. It'd be interesting to know what sort of work we would do at a more formative stage, at a very early stage of a local authority's work, but that might not be the best place to be intervening in mobilisation. So that's a kind of open question for us. as you can see from the timeline, the continuous process and the production of interim outputs throughout was a really important learning point. Don't wait till the end to produce a big product, a big report at the end. Continuous learning is part of the process of knowledge mobilisation, so make sure that the outputs are kind of reflective of that. Trying different things at different times or trying new things with different partners. We did a sensitising video on the evidence for health and safety executive using pretty basic technology, and that was because the HSE had very different needs, and there were a different type of customer. Try new things, they might not all work, but it's worth trying different things to get people's interest. And then we were sort of thinking about this question, but particularly with the HSE, about whether old evidence, and old seemed to be defined as anything that was sort of more than 5 years old, was preferred. Was not preferred to new evidence, and so there's this kind of seems to be a bias towards the new, because everyone wants to feel like they're at the cutting edge of research and decision making. So there's a bit of a question about that, and it's a bit of an open one that maybe people can help us with, how we package different evidence so that it's relevant. We tried to do that with the workshop face-to-face stuff, where the age of research didn't seem to be so much of an issue. Context-specific evidence. So as we know, there's been a great investment in local authority research in recent years, but that wasn't the case 7 or 8 years ago. So we did have evidence from NHS settings that we did use in the workshops, in the face-to-face work, and I think we did make that work because there were some broader points that you could draw across from an NHS setting to a local authority setting. So that was interesting. And that final point there about managing investments in time as a knowledge mobiliser, the report at the end probably wasn't a good investment of time overall. Dave, you have some learning points too.
Thanks, Liz. Yeah, just briefly then. So from us, it was very much about investing in the early phases. I know Liz has kind of alluded to the fact we've done quite a bit of work before Liz came in and supported with her and her team's work with us, but it still felt to us like that was quite early phase support, and we really wanted to make sure that happened at an early phase rather than kind of doing it once we'd sort of landed on some of our priorities, really. Research support is really, really invaluable in terms of helping and shape the evidence and how you think about the evidence, but there's definitely a learning point about, but you need to do some work yourself. So as a team overseeing the employee health and wellbeing framework, we absolutely had to make some sense of that and how we could apply it in a very practical way in our own particular workforce and organisation. It helped us absolutely with our work around becoming a research active local authority. So it gave us some really good kind of ways in to describe what being a research active local authority might look like in a really practical way for us as an organisation, which also links to the next point about the fact that, working with Liz and the team, it certainly, I feel, gave us an added credibility to the end product, because people felt that there was a really robust evidence-based process that sat behind it, supported by Liz and her team and the kind of researchers that we worked with. It can support prioritisation in terms of what's most important. I know it's one of the questions in the chat is about blending and how that might be tricky in terms of some areas being more contentious. I think we did work through that as part of the blending approach, and as a whole team, we probably were making some of those decisions around some of that dot mapping approach within that to say what are some of the things that we think are really important, but also marrying that up with, how far can we push the envelope and what is pragmatic about what we can influence and lead on as a health and wellbeing offer. There's a whole series of things in our previous health and wellbeing strategy that were really kind of noble aspirations from a health and wellbeing point of view, but weren't necessarily in the gift of us as a project team to do something about when we think about things like people's terms of employment, for example. So that there was a balance in that blending process, absolutely. Similar to the kind of embedding research and evidence-based practice into our culture as an organisation, describing that process of how we work with Liz and her team has kind of assisted us in terms of increasing research awareness and literacy amongst staff, so they can see now how that might benefit and be applicable in a really practical way in the workplace, which is all part and parcel of our kind of supporting staff to be much more research literate and much more research aware in the work that they do at the local authority. Liz, I'll hand back to you, I think, now.
Yeah, great. Yeah, I just got some contact details there, but I think probably everyone will have certainly our connections at NoPH, but there's yours in there as well, Dave. Thanks very much. And notice there's some good questions coming in through the chat. So if I stop sharing, then we can maybe open it more to the floor and maybe respond to some of these questions. And now that we've got presentations over, it's very lovely to see people's faces. So if you want to share your cameras, then that would be fantastic. It's always nice to see people who we're speaking to. Oh, thank you. That's nice to see.